neurological disorders, but I will only talk about a few. The first neurological disorder I would like to talk about is fibromyalgia. Fibromyalgia is a cognitive disorder with the characteristics of widespread multi-skeletal pain. Fibromyalgia, certain effects felt from fibromyalgia is sleep disturbance, also cognitive difficulties, fatigue. Now, fibromyalgia, what happens, the brain, the nervous system, and the central cord is also affected by fibromyalgia. So individuals who are diagnosed with fibromyalgia, they will have a cognitive impairment. They can also have issues or difficulties where memory is concerned. They will also have difficulties in mobility, meaning that they will have a bit of issues where walking or doing daily tasks is concerned. So individuals who are diagnosed with fibromyalgia, these individuals will have a chronic cognitive impairment, and it will affect their daily task. Okay, so this disease is chronic, it is long term, and it will affect mobility to sleep disturbance, and it will also cause individuals to feel lethargic or fatigued. Another neurological disorders I would like to talk about, neurodegenerative or neurocognitive. Some of these disorders are Parkinson, Alzheimer's, Huntington disease, ALS, amyotrophic lateral sclerosis. Now, with ALS, it's going to weaken the muscles. It's also going to cause an impairment where functioning development is concerned. Patients who are diagnosed with ALS will have difficulties with memory. They're going to even have the long-term effects of ALS is also going to cause paralysis. It's going to cause paralysis. Other neurological disorders are also MS, multiple sclerosis. Multiple sclerosis is an autoimmune disease, and what it does, the immune system mistakenly attack the nerve fiber of the spinal cord. And all these neurological disorders, what happen with long term, there is a decline, there is a deficit, there will be impairment. All of them have some form of correlations with a decline in memory, a decline in performing daily tasks. They are long-term chronic neurological disease. Okay, they all progress in declining over a time. Other neurological disease are called migraine. Everyone knows about migraines. There are people who have chronic migraine. Chronic migraine will affect individuals. It will cause recurring headaches. So individuals who experience migraine are going to have recurring extreme headaches. And that extreme headache could affect their eyesight, meaning that lights and sound will, because they are having extreme pain and recurring headaches, it will cause them to feel very much uncomfortable with light and sound. Okay, so I want to bring awareness, because we have lots of people in society who are diagnosed with neurological disorders, from fibromyalgia to MS to ALS to Alzheimer's to Parkinson's disease. Although with ALS, it wears away the nerve cells in the brain and spinal cord. Now, multiple sclerosis, the immune system mistakenly attack the protective covering of the nerve fiber of the spinal cord. Now, MS and ALS, they are both neurological disorders. Both of them may have a slight correlation, but not a major correlation. All of these neurological disease, they have a slight correlation, but all of them affect individuals differently. They correlate. How do they correlate? They cause a decline in cognitive. They cause, over time, some of these neurological disease will cause paralysis, because these neurological disease, it affecting the brain and the spinal cord. The brain is connected to the spinal cord. So whatever the brain is the brain, okay? If the brain has a dysfunction or have an impairment or have a deficit, it could cause paralysis, because the brain is connected to the spinal cord. Okay, so as time goes by, I will be talking about neurological disorders. Okay, there are people in society who are diagnosed with these neurological disease. We need to sympathize with them. We need to work with them. Some of them will have limitation. You know, I'm not saying that there is a stigma surrounds the neurological disorders, but what I'm saying is, if you know of someone, or if you have a friend, you have a family member who are diagnosed with a neurological disorder, please understand that these neurological disorders, these said individuals, it's going to affect them long term, and over time the disease is going to progress. And some of these diseases will lead to paralysis, where some of these individuals will lose mobility in their legs. Okay? Some of disease like Parkinson cause tremors. Okay? It causes tremors. It causes brachinesia, which are slow motion. So individuals who have neurological disorders, they are going to have limitations. It's going to affect them. It's a long-term disability, a chronic disability. And lots of these individuals are placed on disability for life. Okay? So we need to understand that we live in a society that not everyone are the same. Some people are going to be diagnosed with neurological disorders. And we need to understand that if these individuals are around our circle, we need to understand that it's not because they want to be the way that they are, meaning that they can't complete certain tasks. So don't get upset when these individuals, if you ask them to complete a certain task and they are unable to complete this particular task, please understand, empathize with them, sympathize with them, because over time these disease, neurological disorders, are going to affect them, affect their daily tasks, affect their daily life. And a lot of these neurological disorders, it affects the cognitive part of the brain. It affects the cognitive part. So meaning that some of these individuals are going to have issues remembering. Some of them may do things that they forgot. So when you speak about a decline in cognitive or a neurocognitive, all of that is issues where memory is concerned. Okay, so I just would like to bring awareness. As time goes by, I will be talking about neurological disorders, okay, or neurological disabilities. But today I spoke more about neurological disorders. Okay, so you all have a beautiful day, and just remember, take care of your health. If you are experiencing any one of these symptoms, please go seek your medical doctor. And lastly, for all these neurological disorders, you can use a multidisciplinary approach, which you can speak with a neurologist or a neurosurgeon if it reached to that, and you can also go through a period of rehabilitation, because as I said earlier, these diseases impair mobility with these individuals. It can lead or cause paralysis. So therefore, individuals will need to go through a period of rehabilitation. They will also need to be assigned a neurologist, because it is these neurological disorders are affecting the brain, the nervous system, and the spinal cord. So anything that deals with the brain, the nervous system, and the spinal cord is going to affect one's mobility. Okay, so keep in mind, you are responsible for taking care of yourself. If you experience any one of these symptoms, the first thing you do is to go talk to your doctor, your physician, and the doctor will do some labs, and then he possibly might assign you to do some CT scans or some MRIs and see and rule out the diagnosis. Okay, he or she will rule out the diagnosis. Okay, and it will be treated with medication and treated with different types of multidisciplinary approach. Okay, so you all have a beautiful day. Thank you all for listening, and happy Sunday to each and every one of you all.